He is not a overweight person. He is not eating too much, and he is a laborer. He got a heart attack. So that's what scenario is changing. A lot of other things have come. Stress has come, and in Dubai, everybody is at a stress, or UAE, and for that reason. So what we have to look after our own health before we advise others. Next, please. That's the commonest thing which has happened is the family history, and in younger patient is the smoking. These are the two common risk factors which I find. In addition to all this, we all know smoking is bad, high blood pressure, diabetes. We all know that. And as a doctor, we have read it. Next, please. Next slide, please. So this is what happens when you eat cholesterol. What you're going to have a nice lunch, and what will happen, all this cholesterol comes and deposits inside the arteries, and gradually it makes the wall thicken, and with one day it becomes totally blocked, and which makes the heart attack. Next, please. So that part, patients usually come with a chest pain, but it's common. If you know the kind of chest pain, they will come to the hospital and they will take a treatment. Next, please. But main problem is when patients have severe chest pain, then it is recognizable. Sometimes they have an unusual presentation. Next. So, and what we do have in the arteries, the blood gets clogged, and which makes the heart attack, and that becomes the heart of the tissue get usually damaged. Uncommon presentation is not so surprising. People had this last patient, which I was discussing, young patient. He was having pain in left shoulder for 3 days, and he came to the hospital, and he was thinking he is to attend the orthopedic OPD. And then we found out he's not an orthopedic patient, it's a cardiac patient. So sometimes this happens. Next, please. So next. Many times when you have unusual presentation, you feel take the local home remedies. Somebody will take a churran, or somebody say soda water. And these are the common things which are useful, but at the same time, they does not help to relieve the thing. Next, please. I will talk about some emergency situation can happen. This patient was coming to the hospital, and because he was a chest pain, his friends, his colleagues from his office, they brought him in the car, and he collapsed and fainted in the car. When he reached in the IC emergency, this was his ECG, which is very wizard. It's like a ventricular fibrillation, and they did a shock and revived him. Next, please. Next. And after a lot of medication, adrenaline, and supportive measures, his heart rate becomes like a junctional rhythm and gradually improved. And next, we took him to the cath lab, and we opened the artery. Next, please. I will skip a little bit because I'm showing that you are all waiting for the next agenda. And this is what happened. His artery was totally blocked, which was opened up. And after that, he started improving very quickly, and his ventilation, everything came off, and he came. Next, please. And some of you are doctors here, and I can see Dr. Vishnu, at least a physician. There are some more physicians here. This ECG looks, to me, apparently normal, which was received after he was revived. So he does not have even a Q wave. So sometimes, if patients get a treatment in a quick time, it's very important. So all of us, even if you know somebody, your neighbor, friend, somebody is having symptoms, guide them to go to the right center. It should be a well-equipped center where angioplasty can be done, because this is the current treatment. Earlier, we were doing a thrombolytic therapy. Now we do angioplasty in most of the patients, whether it is day or night. And sooner we do it, better it is. Next. And next, please. This is what I've already told. What happens if you can open the artery within 60 minutes, the mortality is about 15%. But if you delay the opening the artery at 2-3 hours, its mortality doubles in, say, about 30%. So one has to be very careful for the early timing. Next. Next patient. Unfortunate thing is, most of the heart patients, when they develop a heart attack, 70%, they are not able to reach the hospital, they die. Because of the case which I've shown you, he was lucky that he was collapsed just outside the hospital and he was wheeled in. But if patient remains, the brain remains out of blood supply for about more than a couple of minutes, and then you had it, because there is no chance of return. That's why many people are not able to reach. And that's very important, that if you can guide the people to go immediately. Next slide. And we basically, what we need to have a high suspicion index. We need to have that somebody can can have a heart problem, and that's why we try to avoid and give them a direct advice. First and foremost is that we must give an aspirin. Most of us have aspirin at home, 300 milligram of aspirin, one normal tablet of aspirin. What it does, it stops or at least reduces the chance of blood clot forming. Earlier we used to give a nitrate tablets, and nitrates used to help in dilate the artery, but that helps in angina, but this helps in opening the artery. Next. So this is one first aid which you can do it. Next. So what we need a treatment to open the artery. It should be done mechanically. Next, please. And what our aim is, if you look at the first set of black lines, which means that by the time patient or somebody develops a chest pain, he decides to come to the hospital, and that takes time, a decision, and then he comes with a response to the hospital. And our target is when patient comes to the hospital, he should be thrombolized within 30 minutes with a blood clotting dissolving drug, or angioplasty if it is preferable. That should be done within 90 minutes. If you think this cannot be achieved, then patient should be transferred to another unit which we don't have a facility, then where it can be done. If it is still anticipated it will take more than 2 hours, then we have to immediately give a thrombolysis. These are the things which we need. Nowadays the technology, we should take the help of technology, like the ECG. We should get this immediate information of the ECG. All my patients, emergency room staff, they send me ECG of the patient when they come in an emergency room, and then we take a decision whether he needs a thrombolysis or he needs to go to angioplasty and what treatment to be done. So technology has helped and we should use it. Next. You should remember this man, he's Andreas Grunzig, who started balloon angioplasty. Maybe he has not dreamt at that time that this technique will be applicable in acute MI. He started with a single vessel, and his purpose was that to open the artery instead of doing a bypass surgery in early 1977 when he started the first angioplasty. And this man, his presentation picture from the American Heart Association, and which generated a lot of interest. He developed a catheter on his own kitchen table, because take a balloon mounted on a catheter, and he made it, because at that time there's no devices available. Next. And this is what angioplasty does. It goes there and open the balloon, and you open the artery, and nowadays you put a stent which is like a mesh and which keeps the artery open. And nowadays, which are progressing in technology, every 2 years there is a change in technology. Next. Next, please. I'll just quickly. That's what happened in 80s. Plain balloon angioplasty came. 10 years later, stent came, because angioplasty was very good, but about 1/3 patient used to come back with the problems. And another 10 years later, drug-eluting stents came, which reduces the 20% reoccurrence rate to 5%. And now, in last few years, we have developed a new technology which we call bioabsorbable stents. Many times, patient asks us, we are going to stent, what is the life of the stent, how long the stent is going to stay in the body. Now we can say your stent will disappear. Now this new stent is absorbable, it remains there, and with the various passage of time, in 3 to 4 years it disappears. Just now a new stent has come, which has been released a few months ago, magnesium stent, and this is dissolved within 6 months to 1 year, which has made a lot of change. We need a stent basically for 3 months, maximum. And I have a patient who has got around 14 stents. So he's like an Iron Man. His all arteries are built of iron. Now, even if surgeon wants to go and do it, if there is a problem, there's no place where he'll put a graft. So I think this new technology will help. Next. And this is what happened in the last picture. You can see on the right-hand side that the white spots is the stent marking, which disappears. Next. Next. I just won't go to the data. Next. And this is the artery which it looks, if you can see, and then it can be opened up. Next. Okay. Next. What we have to understand that our waist, we should not put on weight. For the males, it's important that their waist should not go more than 47 and 42 in the females. That's the upper limit. Preferably, if you can be less than 35 and 40, that's the range. But if it is the maximum, you can have it. And it is very common in the in our area in Middle East is very common, and the central obesity is linked with the heart problem. Next. Exercise is good. Next. And by eating healthy, we reduce the calorie intake, take the small amount of food, and which helps to reduce your appetite, and that you can help. Next. We feel sometimes we are eating salads. It's very good. But we put mayonnaise on it and a lot of salad dressing, which contains a lot of oil, which we forget about it. We think that we are having healthy food. Anybody, there are a lot of children here. What is common in this slide? Anybody can guess? Younger generation. All the children, can you tell me what is common in all these slides? All junk food. Very tasty food. That's the point. That's why we eat it. All tasty food, which contains a lot of calories and which is not good. And McDonald's and Burger King have done a lot of damage to us. But now the trend is changing. They are all companies are provoking, making them a less calorie intake food. Next. What is common in this? They're all sweet, but they are still less calorie as compared to the last slides. Next one. So this is the exercise where I promote. Next, to keep your health healthy. Next, it reduces the cholesterol. It reduces the chances of the heart attack. Next. I'll just change. What is common in this slide? This is all relaxing exercises. Very good. We want people to relax after the work, whatever they do. Next one. And what is common in this? This is also exercise. And go the last one. And sorry, it's okay. Come back to the last if you can. So the difference is the first one was the relaxing but without physical exercise. Second one is exercising and relaxing, so which is good. So you are also burning calories. So that's what you have to do. Next. So that's what I'm showing. Forward. Yeah, now this is the cost of urbanization. What we have done in Dubai, this is the Dubai roads, what you see. And what we happen once we feel we have got a landmark building and everything, but which has got people have moved from cycles to the motor cars, and motor car is the biggest enemy of the human race. That's what I believe. Automation has stopped doing anything. Today morning I was reading in the newspaper, there was some article that Google has come up with some modern version of Alexa. I don't know how many of you know Alexa. Alexa is a device which has been made by Amazon. And what they do, it is a device sitting on you like a speaker. You tell Alexa, give me some music. He'll say, Alexa, give me some Kishore Kumar music. So my son got it, and we are Skyping him. And I told, look, can it show me this about the Kishore Kumar? He was giving the English numbers. And then she gave me like Kishore Kumar music as well. So a lot of things are happening. It switches off the light of the different areas, switch off the other extra AC which is running. So you're again going to make it so much automation, people are not stopping and walking within the house. So I think it's good as a toy, but not good for the health. Next. Okay, I think I'll stop it here. So basically, I just wanted to tell you that you have to control your numbers, you have to control your cholesterol, blood sugar, and this helps to, everybody should know that about 100 blood sugar is normal. If it is going beyond, you have to be careful. Cholesterols, you have to, LDL is very important. It's what we call bad cholesterol, and HDL, which improves the exercise. And these we have to do, all of them from the young age. We have to teach our children what they should eat and how they should improve. Thank you very much. I think I'll stop it here.
I consider it's a great honor to give memento to an eminent cardiologist of the stature of Dr. Rajiv Lochen, who was a director of interventional cardiology as far back as 30 years back in 1987. So it's a great, it's our fortune. We are very fortunate to have him in Dubai here. And it's a great honor for me to give the memento to him.
Thank you, Dr. Subramanian. I request Jafar Ali to give the memento to Nisar.
I have to thank Mr. Nisar of Medar Hospital, who has given, with the help of Dr. Sitaram to initiate, to do at least, yes, they have given us the first sponsorship. We are thanking very much and I wish you will continue as so that our Telugu community, Telugu doctor community will have more gatherings. And we have, I thank you to also to bring over the stage Dr. Rajiv Lochan, who has given a very good presentation to us. Thank you very much.
I used to come to Wellcare Hospital with my patients to Rajiv Lochan. Yeah. By the way, what is the meaning of Rajiv Lochan? Can anybody tell?
Any youngsters?
Any youngsters, please? Narayana? Rajiv Lochan.
ఎవరు ఒకళ్ళే శ్రీరాముడు.
శ్రీరామచంద్రుడు రాజీవలోచనుడు కమలములు వంటి నేత్రములు కలవాడు. I don't know whether Rajiv Lochan knows the meaning of his name. He is direct Sri Ram, and Sri Ramachandra has blessed all of us today. Thanks a lot to him.
Thank you.
Important presentation by Ramakrishna Housing. They are doing a very good venture called Ramakrishna Ventura. He is a bit upset, saying that it is the last, why you are making it last. But I wanted particularly to make this to be in the last program, so that the people, everybody will able to sit for until the lunch, and they will take this presentation in a positive way and give him a good, actually the very good venture is coming up over near to our Andhra Pradesh capital. He will come over to the stage, and he is one of our main sponsors and for this event. And I thank you. Please come out to stage, Mr. He was very upset. He was angry with me. But anyhow, I told, don't worry, you will get a good presentation and good audience over there.
నమస్కారం అండి.
I recognize the presence of Mr. Tulsi Prasad Garu. He is also one of our important Telugu community members. Just tell hello to everybody. Our wife, please. Just stand up so that everybody will be knowing. He is also one of the important committee members of our Telugu community. Thank you very much for coming to the stage.
థ్యాంక్స్ అండి. జాఫర్ గారు నా గురించి చెప్పారు. నా పేరు సాంబమూర్తి అండి. ఐ హ్యావ్ కమ్ ఫ్రమ్ విజయవాడ ఎస్టర్డే, ఫ్రమ్ హైదరాబాద్ బేసికలీ. అండ్ నాది లాస్ట్ పెట్టారని కాదు, కానీ నా ప్రాబ్లం అంతాను నా వల్ల మీకు తిండి లేట్ అవుతున్నదని అదొక్కటే బాధగా ఉంది, అంతకంటే ఇంకేమీ లేదండి. సో నన్ను క్షమించండి. నేను యాక్చువల్గా గంటనే ఇవ్వచ్చు, 2 గంటలను 3 గంటలను ఇవ్వచ్చు, కానీ మీ ఫుడ్ డిలే అవ్వకుండా నేను ఎంత కట్ షార్ట్ చేసి అంత కట్ షార్ట్ చేసి ఇస్తాను. నాకు ప్రజెంటేషన్ ఇవ్వడానికి 4 గంటల టైం కావాలి మినిమము. ఎందుకంటే ఐ హ్యావ్ నాట్ కమ్ హియర్ ఫర్ అ సేల్ అనమాట. ఐ జస్ట్ వాంటెడ్ టు లెట్ యూ నో వాట్ ఈజ్ హ్యాపెనింగ్ ఎట్ అమరావతి, విజయవాడలో ఏం జరుగుతున్నది, ఏంటి, వై యామ్ ఐ హియర్, అండ్ బిజినెస్ ఆపర్చునిటీస్ ఏమున్నాయి మీకు అని చెప్పడానికే వచ్చాను నేను ఇక్కడికి. అండ్ బై ద బై థ్యాంక్స్ కేసరి గారు ఫర్ గివింగ్ అన్ ఆపర్చునిటీ. అండ్ లెట్ మీ కంగ్రాచులేట్ యూ, ఫస్ట్ ఆఫ్ ఇట్స్ కైండ్. అందరూ తెలుగు డాక్టర్స్ అందరూ ఒక ఈవెంట్లో పార్టిసిపేట్ చేస్తున్నట్టుకు వచ్చినందుకు ఎ బిగ్ రౌండ్ ఆఫ్ అప్లాస్ టు యూ ఆల్ ఫర్ యువర్ సెల్ఫ్. అండ్ నేను 15-20 మినిట్స్ కంటే ఎక్కువ తీసుకోనండి. యాజ్ ఐ సెడ్ 4 hours, బట్ 15-20 మినిట్స్ కంటే ఎక్కువ తీసుకోను. నేను ఐఎమ్ సాంబమూర్తి. మీరందరూ ఇంట్రడక్షన్ ఎలా ఇచ్చుకున్నారో అదే ఇంట్రడక్షన్ ఇచ్చుకుంటాను నేను. సాంబమూర్తి, ఐఎమ్ వన్ ఆఫ్ ద డైరెక్టర్స్ ఫర్ రామకృష్ణ హౌసింగ్ అండి. ఐఎమ్ బేస్డ్ అవుట్ ఆఫ్ హైదరాబాద్, బట్ ఐ టేక్ కేర్ ఆఫ్ ఎంటైర్ NRI అండ్ సేల్స్ అక్రాస్ ఇండియా అండి. నాకు ఒక వైఫ్ ఉంది అండ్ ఒక కుర్రాడు. ఓకే వైఫ్ అండి. అండ్ ఇందాక నుంచి అందరూ చాలా కూర్చుని చాలా సీరియస్గా చెప్పించుకుంటూ ఉంటే నేను అనుకున్నాను కొంచెం మధ్యలో వచ్చి ఎంటర్టైన్ చేద్దాం అనుకున్నాను. బట్ నా ప్రాజెక్ట్ ఎంటర్టైన్ చేశానని అనుకుంటారు కానీ కాదు. ఎనీయో, నాకు ఒక కుర్రాడు ఉన్నాడు. హీఈస్ ఇన్ 7th అండి. దట్స్ మై ఫ్యామిలీ. అండ్ ఐఎమ్ బేస్డ్ అవుట్ ఆఫ్ హైదరాబాద్, బట్ ఐ కీప్ మూవింగ్ అక్రాస్ ద గ్లోబ్ అనమాట. అండ్ ఈ ఇయర్ దిస్ ఈజ్ మై 8th or 9th విజిట్ టు దుబాయ్ అండి. ఓకే, సో గెటింగ్ బ్యాక్ టు ద ప్రాజెక్ట్ అండి. ఇది రామకృష్ణ హౌసింగ్ అనేది ఇట్ ఈస్ కమింగ్ అప్ ఎట్ విజయవాడ అట్ అమరావతి అనమాట. అండ్ నెక్స్ట్ అడ్జసెంట్ టు నాగార్జున యూనివర్సిటీ. ఐ విల్ జస్ట్ టేక్ టు ది ఓవర్. ఓకే, this is the entire site అండి. Lights off. Okay, if you just look at it అండి, మాస్టర్ ప్లాన్ చూపిస్తున్నాను మీకు. మాస్టర్ ప్లాన్లో దిస్ ఈజ్ అబౌట్ 173 acres which is just adjacent to నాగార్జున యూనివర్సిటీ. మేము ఆల్రెడీ 55 acresలో వీ హ్యావ్ సోల్డ్ అవర్ ప్లాటింగ్. And this land was acquired close to about 8 years back. And 55 acresలో ప్లాటింగ్ అమ్మేసాము. దాని తర్వాత సబ్సిక్వెంట్గా ఒక 10 acresలోని వీ హ్యావ్ కన్స్ట్రక్టెడ్ ఇండిపెండెంట్ విల్లాస్ అనమాట, అది అమ్మేసాము. నౌ బ్యాలెన్స్ 100 acresలో 42.5 acresలో వాట్ యూ సీ ఎల్ షేప్లోని దిస్ ఈజ్ అవర్ వెంచర్, ఫస్ట్ ఆఫ్ ఇట్స్ కైండ్ ఇన్ I can say in Andhra Pradesh, Telangana, Karnataka and Tamil Nadu, South India loni. The reason is 86% open to sky. We are not giving a concrete jungle. We are giving a living ultra luxury property and that too price compared to our competitors much lower. Okay, I will give you my competitors pricing also. Then 42 acresలో 25 towers వస్తున్నది. phase 1లోని 8 towers కడుతున్నాము, close to about 1760 flats వస్తున్నాయి. And we have 4 sizes అనమాట, 1275, 1425, 1700, 1900. Okay, అది కాకుండా we have a sky villas 31 floors, as I said. Last 4 floors sky villas కింద 2900, 3100 and 4050 square feet sky villas వస్తున్నాయి అనమాట. అండ్ దీంట్లో phase 1లోని 8 towers వస్తున్నాయి, క్లోజ్ టు అబౌట్ 1760. అండ్ phase 2 and phase 3 we have. Go back to the master plan. And ఈ దీంట్లో ఏంటంటే 30 acres we have 30 acres. What you see in this, it's a commercial complex, commercial towers like IT, shopping malls, hospitals ఇవన్నీ ప్లాన్ చేస్తున్నాము. అండ్ హై అండ్ విల్లాస్ దాని వెనకాతలు ఒక 20 acres హై అండ్ విల్లాస్ ప్లాన్ చేస్తున్నాము. ఇన్ దిస్ ఇంటిగ్రేటెడ్ ప్రాపర్టీ టవర్స్లో 172 acresలో వీ హ్యావ్ ఒక స్కూల్, డిపిఎస్ వరల్డ్ స్కూల్ స్టార్ట్ చేసాము ఈ ఇయర్ నుంచి. అడ్మిషన్స్ కంప్లీట్ అయిపోయింది, టెంపరీ షెడ్స్ ఈ విల్లాస్లో కట్టామన్నమాట. దెన్ బిహైండ్ దిస్ వీ హ్యావ్ ఎక్వైర్డ్ 100 acres. దాంట్లోని 6.5 acresలోని అబౌట్ క్లోజ్ టు 6,000 పీపుల్కి సరిపోయే ఒక స్కూలు 2 yearsలో కన్స్ట్రక్ట్ పర్మనెంట్ స్ట్రక్చర్స్ రేజ్ చేస్తున్నాం. అండ్ మోస్ట్ ఇంపార్టెంట్ పాయింట్ మీ డాక్టర్స్ అందరికీ చెప్పవలసింది ఏంటంటే, ఇంత పెద్ద కాంప్లెక్స్లోని డాక్టర్స్ లేకపోతే ఎలాగా, ఇట్స్ అ బిగ్. అండ్ క్లోజ్ టు అబౌట్ యూ కెన్ ఎక్స్పెక్ట్ 25,000 ఫ్యామిలీస్, మీకు 10,000 ఫ్యామిలీస్ ఈ చుట్టుపక్కల మా వెంచర్లోనే ఉంటారు. అండ్ వీఆర్ ఆల్సో కమింగ్ అప్ విత్ ఏ హాస్పిటల్ అనమాట. వెరీ సూన్ 3 years లోపల వీ విల్ కమ్ అప్ విత్ ద నేమ్స్ వన్స్ ది ప్రాజెక్ట్ ఈజ్ రెడీ. అండ్ ఈ 86% ఓపెన్ స్కై దీంట్లోని వీఆర్ గివింగ్